Hello, it's me again, Dr. Hollen Meyer, and I have another interview, and it is one of my favorite doctors, Dr. Andrew Oteo. Somebody thought they should smoke out here. I gotta move. Although I should probably stand by there. So they can understand what real health is and what that means with chiropractic care. Okay, so cool. That tournament. Okay, Dr. Oteo, you're on.
Are we on? Hey, I'm doing great. How are you?
Doing good. I hope the announcements aren't too loud. There's literally like a speaker every 5 feet, it seems like.
Nah, all good. I can hear you.
Awesome. Okay, cool. So, Dr. Oteo, I'm going to give it an introduction and let you kind of take it away. Dr.
Cool.
Oteo is part of the Wellness Doctor Network, and the Wellness Doctor Network is something that we've created to connect the community to top-notch doctors that have a wellness mindset. And what we mean by that, it's a 3-step approach. The first, and hopefully only step, is to be proactive and natural. Or the second step is non-invasive therapies, and if you need drugs and surgery at that point, we have those options available, and our goal is to always get you back to optimal health where you're in control. And Dr. Oteo, he is at the front end of that process and the back end of that process to keep you healthy, teach you how to be healthy, and what true optimal health really means. So he is a chiropractor in the Colony, Texas, which is near Frisco, North Texas.
See you soon.
And he's wrapping up with patients right now. So tell us a little bit about yourself, Dr. Oteo, and kind of what brings you here. Give us a little introduction.
Yeah, so I have been in practice for almost 10 years now, and so it's crazy how time flies when you're having fun. I'm over in the Colony, so for many of y'all that know the North Dallas area, it is all expanding, and we're just really excited to be planting roots over here. But I am just so blessed to be a part of Texas Chiropractic Association, Parker University Alumni Association. We've had a lot of different opportunities to plug doctors into different things like this. There's such a need for us to all work together, and I think that's a big misconception. Is a lot of times we feel like an island. We're a doctor in the field, we're treating patients, and we feel like there's no camaraderie, no teamwork. But I'm really happy that, Hollen, thank you so much for establishing this, so we can really kind of create more of a bridge and all have more of that united front versus how sometimes we don't really realize who can do what for our patients and how we can add more value to their experience. So, but I started off in practice, and I really, like many other people, didn't know how the business side of even what I did worked, how that functioned, and how to really create success through what I was doing in my profession. And over the years, I've had the opportunity to mentor many chiropractic students and really kind of create my own brand or my own identity of what chiropractic is to me and how I want to help people. And that's one of the beautiful things about even being a doctor is we can really create how we want to help patients through what we really, how we see just an experience of what we truly believe in. And so my office over here, we are able to help people through chiropractic care. We do have also physical therapy in our office and a variety of different other services that we use to kind of bridge that gap as well. So, that's one of the things I love about my practice is it is an expression of really it's an artistic thing. We talk about chiropractic being a science, art, and philosophy, and with what we do here, we're centered towards results, and we're centered towards patient outcomes of meeting their goals and their expectations.
That's awesome, and that's one of the reasons that you're part of the Wellness Doctor Network, because of the integrity that I know that you've got, because I know you personally as well, and then also the results that you do get. Before I jump into some of the specialty things that you do and want to ask about that, stuff like TMJ and some of those cool things, what is chiropractic to you, and what message do you want to relate to your patients, your future patients, the medical doctors and the medical teams that are watching us right now, and even chiropractors and students? What is chiropractic, and what do you want them to know about chiropractic?
Yeah, that's a great question, and that can be subject to change based on who you ask on that. Chiropractic, just to put it in a nutshell, it's a form of therapy. It's a form of healing, that uses no drugs, no surgery. So the cool thing that I love about chiropractic is it really takes a least invasive to most invasive approach, which is really what we should be about in terms of our approach to healthcare. So, you know, I don't prescribe medications, I don't perform injections, I don't do any surgeries here in my office, but that's why it's important for me to work with other doctors in those situations, because we have a variety of different types of patients that come in for all different types of issues. And the first thing that I tell people up front is, hey, I don't know if we can help you. That's really what this is all about, is finding out what kind of condition you have and how this relates to what we can do in terms of our office or making a referral to another office. So chiropractic is an amazing tool that we have. It's something that I've seen change people's lives, and it really all comes down to how the spine is functioning and how that relates to the nervous system. Okay, so a lot of times, I'm going to just kind of even show you this poster we have. Y'all can see this. This is something that's very familiar to many of you guys, but we're looking at nerve function. And a lot of times when I have patients come in here, the reason I became a chiropractor is because I was having neck issues that started having numbness into my two digits, my digit 3 and 4 on my hand. And so nobody ever connected the dots that this was a result of what was going on in my neck. And so when I finally learned that the nerves in my neck actually control what was happening to my fingers, and I stopped getting injections and I started getting adjusted, that's when the light switch went on for me, and I really found a tool that I could help a lot of people with. And so one of I love this chart. I'm going to show you guys this one. I know it's all backwards, so just relate with me on this one, but it shows the different vertebral levels, what things it innervates in the body, and then these are all symptoms. So I have that in every one of my consult rooms, because when patients read that, I can't tell you how many times I have patients that read that and say, hey, I have stomach issues. Could that be related to my spine? Or I'm having numbness and tingling in my foot, and I thought that was a sciatic issue. Is that something that's related to my spine? So, you know, even though a lot of these things seem really basic to us, it's like, yeah, the spine's connected to everything, I don't think a lot of people realize the full connection of what the nervous system is and how it really impacts the function of each segment of our body. So.
Right, and that's a great explanation. I remember you filmed your interviews and taped your interviews. I loved our discussion then too, and you talked about how we get kind of dubbed as neck and back pain doctors, where when it's like, chiropractic is very, very helpful in those scenarios and those situations, but we're really nervous system doctors, right? So tell us more about that. How does the spine protect the nervous system, and then what do chiropractors do to help that, or why would chiropractors even do anything?
Yeah, and so the nervous system obviously is, controls everything. We don't think about we don't think about our lungs breathing, we don't think about our heart beating, but all those things are happening in like this perfect system in our whole body. It's such a cool thing to think about, like how all these little enzymes and hormones and everything just come together so perfectly, and that's what we call, innate intelligence, and I call that God, that's that divine connection. But through that, if you think about why do we even have a spine? What's the point of having a spine? Why aren't we just, some kind of like big jello mold hanging out? The spine keeps us upright, it keeps our posture, and it protects the most fundamental thing, which is the nervous system, the spinal cord that runs down through that. And then we have these holes, or those foramen, that actually exit out, and they go out to the muscles, the tendons, the ligaments, everything, every cell, organ, tissue. And so that's why there's things that happen. And Hollen, you know this too, just from being in practice. There's times that patients come in here with symptoms that I'm like, hey, I will be straight up with you. I don't know if chiropractic can help with this. But I know if we start clearing out some of the communication and we just kind of hit the reset on some of these nerves, we can see some changes, and we hope to see those changes. And I've had patients come in here with all kinds of different things. Like, I don't treat menstrual cramps, okay? That's not something I advertise of like, hey, come see me for your menstrual cramps, I mean, that's not a common thing that you would see a chiropractor for. But sometimes we will see changes with those things as a result of allowing their spine to function more efficiently. So not that I'm saying refer me patients for menstrual cramps. I'm just saying a lot of times when patients see us for lower back pain, there's other symptoms that they don't really recognize that could be associated with that as well too.
Right, and that brings me to the point that you don't need any pain in order to go see a chiropractor. The fact that it helps all of these other things, because we're talking about the central nervous system, which is the brain and spinal cord, controls everything. And yeah, people see side effects of gut issues being improved, and menstrual cramps being improved, and heart and lungs, everything that the brain controls, which is everything. But if you have a spine, you should absolutely get checked for a subluxation, because you might not, what chiropractic does is it gives you at least the opportunity and the likelihood of your body to have the potential of functioning at 100%. Because chiropractic, we remove that interference, that subluxation, that misalignment. And some people don't even know they have it. A lot of times people think they feel good and they go see a chiropractor and they're like, oh, I didn't realize that I didn't feel great. And that might be pain, that might be headaches, that might be something totally that they didn't relate necessarily to chiropractic. But if you've got a spine, you should be seeing a chiropractor. Would you agree with that?
100%. And, that's 100% agree with you. There's also the whole theory of like, have you ever heard this, Hollen? How do you boil a frog? Do you know how to boil a frog?
No, but hold on. Before you tell me that, if any of you watching have questions about chiropractic, have a success story about chiropractic, I know there's a lot of chiropractors on here watching too. Give us some insights of what you think chiropractic is too. So now tell us about the boiling frog.
So, okay. If you were going to take a frog and put it in a boiling pot of water, it's going to jump right out, right? It's going to recognize that it's in a situation of distress. It's going to jump right out. But if you take a frog, you put it in, nice warm water, and then you slowly turn the heat up, it doesn't recognize those changes, and it'll slowly boil, okay? So that's part of the deal is we are that frog sometimes. We have these situations that happen where like, oh, it's just a little stiffness, it's just a little soreness. And then by the time we realize it, we're in crisis mode and we don't know what to do, So that's a very common thing that I'll see. Many times, I'm sure many of y'all see patients who, let's just say, just kind of talking about stereotypical, a mom with a few kids that has done so much for their family that they haven't had time to take care of themselves.
Yeah.
And before they know it, they're in the office and they're like, hey, my legs are numb, I have headaches every day, I'm not sleeping, I'm taking medications for stress and depression and anxiety. And so they have slowly over time evolved to this other lifestyle that it's not what they recognize, it's not what they want, and they're looking for somebody to just kind of help them lead that way. And that's one of the things that we see very frequently in our office, and it's something that I love is changing somebody's life and seeing somebody who starts in a situation of total distress and bringing some balance and equilibrium back to their spine. The other part about why people should get checked is vertebral subluxation complex. When we start seeing even segmental decrease with their spine, it's gonna decrease different types of thresholds. So we'll start actually seeing nociceptive thresholds being decreased, which means people are going to start having pain a lot more easily in different areas. And also block some of the different proprioceptive areas for the mechanoreceptors for the spine. So we start noticing, as we're first adjusting somebody, a lot of times we'll get really good results in a few visits. We'll start saying, hey, this is amazing, I'm feeling so good. And then we start kind of leveling out with their mechanoreceptors and how that initial input is. And then we start kind of working on strengthening. And I was even watching Dr. Williams talking about this the other day. He was talking about core strengthening, right?
He's a laser spine surgeon, by the way, is who we're talking about, Dr. Williams. Mm-hmm.
And we talk a lot about like upper and lower cross syndrome, and like what he was saying was speaking to me on that, because when we see upper cross syndrome, I'm just going to I have long arms, so I'm going to hold the phone. You see the neck going forward like that, the posture hunching forward. We see like the lumbar spine getting really tight and stiff, the hips out of alignment. So it's not just like a neck, upper back, lower back issue. It's a global phenomenon that we talk about with upper and lower cross syndrome.
Right.
And when I'm talking to somebody about, their neck, many times, and you talked about this too, Hollen, is it's asymptomatic in some point. This might be a little bit dark, but can you all see this? This is phase 3 degeneration, okay? And when we look at stuff like this is a little model about phase 3 degeneration. Let me hold that. So that's a lot of times what we'll see in our office, okay? And this is what we'd consider y'all already know this. This is normal, right? But I have patients that come in here all the time in phase 3 degeneration that have zero pain, okay? They're like, hey, I'm just really stiff. My neck isn't moving properly. I just feel like I'm kind of tight. And then I start feeling their neck. I start palpating how the segments are moving, and I'm hearing all kinds of crunching going on. And I'm like, do you feel that? Do you see that? Do you understand that's not normal? And then we start taking x-rays. We do what's called a penning motion study, where we actually have, in the cervical spine, we'll have them flex and extend their neck through range of motion. So it would be kind of comparable to doing like a motion fluoroscopy examination, where we can actually see the segments move. And that way we can show them, hey,
that's super unique with your office. That's one of the things I love is a lot of chiropractors do x-ray, but you've got basically motion x-ray. Mm-hmm. Right? So people just stand still. They're not really in pain, but you get to put them through a motion that elicits pain too.
Well, most people are I talk to a lot of patients that say, hey, I feel great if I'm standing still, right? I'm here in this position. I have no pain. The second I start moving my neck or bending my lower back, that's when the pain starts. So it just kind of makes sense that we'd actually want to take images while they're going through certain ranges of motion, so we can show them, hey, this is proper function. This is what the joint should look like. This is what yours are doing. And we actually do pre and post. And there's a lot of different things that you can measure in terms of like joint function or how things are improving. A lot of times we'll talk about like curve correction of the spine, but really what I like to talk to patients about is more functional correction of the spine. So we'll actually take them back through those x-rays after a series of visits, and we'll show them, hey, before you had 4 bones in your neck that were locked up, they weren't moving properly. We'll show them the after, and then they can see a huge difference in pre and post. Right. And I'm all about creating expectations for people. You know, I never make claims, hey, we're going to get rid of that arthritis. We're going to get that disc space back for you, and everything's going to be 100% like you were when you're 18 years old. But when we create that expectation of, hey, we're going to get the function better, and then we're going to work together to make sure that we can create a game plan for you so you can, you know, work on your posture, right, work on some of these corrective exercises. And that way, really, we can talk about lifestyle changes versus just the short term, like, let's help you with your pain, you know, which is a Band-Aid plan. We provide that as well, but that's where I get most excited is about those lifestyle changes.
Right, that's awesome. And even on the motion x-ray, because we have some medical doctors and chiros listening in too, you can refer to his office for those x-rays. And of course, I mean, they're just coming in for the x-rays, or if you want him to take a look at them, help you read them. He does offer that to his colleagues as well, both medical docs and chiropractors or physical therapists, whoever you are. That service is available for you to refer over to. And I want to jump gears a little bit to something that I know you love to talk about, you love to work with, and that's TMJ dysfunction. Can you explain, first of all, what is TMJ, what does it stand for, and what is the dysfunction? Who would come in to see you for this?
Yeah, so, you know, temporomandibular joint, so, you know, right here, if y'all can do a little test, open your mouth, if you feel a pop, a click, you know, things kind of moving aside. A lot of times what we'll see is the jaw shifting positions like that. There's a lot of it's like a Rice Krispie treat, you know, snap, crackle, pop. We'll have a lot of that associated with motion, and many times that's preventing them from speaking. It's preventing them from really even eating certain foods, and that can be a really just not a fun situation for people to have. And TMJ is very tricky. There's a lot of different components that we have to look at when we're assessing the jaw, and when we're treating it, it's such a small area in through here. There's a lot of different muscles around this area. We also need to be very careful about how we're doing our treatments and our adjustments with that. So we have a lot of dentists that refer to us for TMJ because there's kind of a gap in terms of like what people can do. Like the options are very limited for TMJ. They go to a dentist, a lot of times they'll get like a night guard, you know, they'll refer them for possibly braces if it's necessary, and then after that, surgery is definitely one of those things that could be on the table for them. But with physical therapy, you know, we go through and show them a lot of different stretches and exercises to do for the jaw, for strengthening it. And it's weird to like exercise your jaw, but if you've ever had a TMJ issue before, it's one of those things that can make a huge difference for the function. But the adjustments that we do are, you know, and I should kind of let you guys know up front, I treat a lot of different type of patients here. So we have children that come into our office for adjustments. We have elderly people. We have professional athletes that we see. And so adjustments are not always a very dynamic thing. It's sometimes a very gentle, very slow thing that we do. I know a lot of times we watch YouTube videos and we think everybody's like, we're gonna hear like all this popping noise when we do this, but a lot of times in the TMJ we won't hear like a huge pop or a click or anything like that. But when we do a lot of these adjustments with the jaw, a lot of it is soft tissue based to help glide and maneuver that jaw through range, because the challenge with that too is the discs. Like in our spine, we actually have the lateral pterygoid muscle connects up into creating a disc for that jaw and through there. And if that slips out of position and we start actually creating a new condyle or a new area where that starts connecting, that can really cause issues, and at a certain point we can't help any further with conservative care. So there's a time and place for conservative care. That's why we try to catch things sooner rather than later, so that way we can create a solution for people before they are in a crisis mode, with especially the jaw.
Awesome. I think that's just such a unique thing that a lot of chiropractors adjust it, but Dr. Oteo specializes in that, and so there's a lot of things that he can do that's not just a very general type of approach, that he's got a lot of extra training in that. He also sees car accidents as well. So if you're anywhere in the North Dallas area, or people travel from all over to come see him, but definitely give his office a call. How can people get in touch with you?
Pretty much anyway. We have a website, we got Facebook, we got all kinds of stuff.
What's the website and what's your phone number? Your office phone number.
Our website is www.stonebridgechiro.com, CHIRO. Our Facebook page, we always have a lot of fun on Facebook, so I encourage you guys, follow our Facebook page. And then our phone number is 469-535-3800. And if you have any questions, or I'm a pacer. I use my hands a lot. You can't see my hands, but I'm Italian and I talk with my hands a lot. So, but we have a lot of different stuff that we do over here. And if you'd ever like to come over and just meet with me and see what we do, I'd love to welcome you over as well.
Awesome, awesome. Well, thank you so much for your time, and thanks for being part of the Wellness Doctor Network as well. Thank you for everyone listening in live and also on the recording. I'll post his phone number in the comments or maybe in the original message too. So thanks so much for joining us. Have an awesome day.
Thank you. Appreciate it.